Hello, my name is Tina, and I'll be your educator for today. I've been an oncology nurse for 30 years, and I'm one of the several oncology certified nurses here at Enloe Health ready to join your healthcare team and take care of you. Thank you for making time to attend this class. You might be a little anxious, and that is understandable. We're here to provide you with important information that will help your treatments go the best that they can. I have some good news for you. Cancer care has changed so much in recent years. I can tell you that it is changing for the better. For one thing, your treatment is getting more and more tailored specifically to what you need. It's not like what you are used to seeing on TV or movies. We've also improved in supportive care and symptom management. Especially if you are worried about nausea and vomiting, you can relax. We have a good handle on stopping nausea these days. In fact, there are anti-nausea medications that have been developed that stop nausea for 72 hours. You've already had or will be having a one-on-one meeting with a nurse or an advanced practice provider. But you receive so much information in that meeting that it is nice to have another opportunity to go over the education. This class will offer information for both oral medications and for getting your treatment in the infusion clinic. We'll talk about traditional chemo and the newer immunotherapies. Take a deep breath. We realize there is a lot of information to absorb when you receive a diagnosis and are starting treatment. That's why we offer this information in many different formats. Everything I teach today can be found in your binder. All of the information that I'm covering today is also discussed in our treatment videos online at www.enloe.org. If you feel like you need to hear it again, you can go online and watch the videos. It really helps to hear things more than once. Online videos are also very helpful for other family members who might be helping you with your care. They may not have the opportunity to hear the education that you get from the nurses, so this is their chance to learn what is going on. If I covered everything today, it would be so overwhelming. So please visit the Enloe webpage and watch the videos that we've provided for you. Go to enloe.org/cancer hyphen education, or go to enloe.org and click on the Care and Treatment button. Select Cancer Care, and all of the videos are there for you to watch at your convenience. You don't have to worry about writing everything down. The things that we are covering are also in your patient guide. Look in the back to find additional information about dealing with side effects and things that you can do to feel better. You will also receive additional education specific to your type of treatment from your nurse. You can keep that in your patient guide for easy access. May I suggest that you grab a pen and a piece of paper so that you can write down your questions as we go along. Your questions might be answered later in this presentation, but if they are not, make sure that you ask your nurse or other provider. When you start treatment at the Cancer Center, you have a whole team working for you. There are a lot of members on your team. Not everyone has the same role. Legally, certain team members can do certain things. You might ask a question to someone, but that question is outside of their scope of practice, so they can't answer it. For example, medical assistants are not trained to interpret lab results, so they can't give you that information, but they will get your question to the appropriate team member who can answer your question. This team is led by you. So we need you at all of your appointments to communicate with us. Communication is the key. A team doesn't work well when the leader of the team doesn't communicate. Don't try to tough it out or not let us know what's going on. We need to know what's going on in order to be the best team that we can be for you. Let's dive in. No matter what kind of treatment you are getting, you will be scheduled for regular lab draws during your cancer treatment. By looking at your labs, the team can determine if your blood counts are in the right range for you to receive your treatment. You might also be scheduled for labs before an appointment with your provider. For your convenience, we have a drive-through draw station, which means you don't even have to find a parking space. Even if you have a port, which we will talk about later, your blood work will be drawn from your arm. This is because ports are only accessed by a trained registered nurse, not by our lab staff. Please get your labs done the day before you come in for your chemo treatment. But if coming in on the day before is a serious hardship, talk to your doctor's nurse to see if other arrangements can be made. You'll be surprised at how quickly you can see your labs if you are registered for MyChart, the Enloe patient portal. If you need help getting into your portal, you can ask for help at the Cancer Center Library. You can also ask for a printed copy of your labs. Some patients really like to keep track of their labs, and others really just want to know if the treatment will happen or not. You get to choose. This is what your CBC or complete blood count lab report looks like in MyChart. Pre-chemo blood work lets us know your counts are in the right range for you to safely receive treatment. There is a lot of information to read on that page. When the nurses look at these results, we are basically looking at three things: the red blood cells, the white blood cells, and the platelets. Your red blood cells carry oxygen from your lungs to the rest of your body. When your red blood cells are low, you might feel more fatigue or short of breath. Your white blood cells are your infection-fighting cells. There are several types of white blood cells. The specific white blood cell that we look at is the neutrophil count. Your neutrophils are your body's white blood cells that are ready to activate if you are exposed to an infection. When those become low, you are at higher risk of getting an infection. This is called neutropenia. Your platelets are your cells that stop bleeding. When your platelets are very low, your body is more at risk of not being able to stop a bleed, either external, like a cut to your skin, or internal, like a bruise under your skin. There are different precautions we ask patients to take depending if they are low on their red blood cells, their white blood cells, or their platelets. Your doctor might also order a comprehensive metabolic panel, which measures how much glucose, sodium, potassium, and chloride are in your blood. Checking to see that these things are in the normal range is a way to be sure vital organs like your liver and your kidneys are doing well with the treatment. In your one-on-one education meeting, the nurse will tell you more about what labs you specifically need. Seeing labs quickly is one of the advantages of MyChart. Being able to do your check-in questionnaire before you get to the appointment also saves you time. MyChart is also a great way to communicate with the team because you can send a non-urgent message any time of the day or night. This is important. Only use MyChart messages for non-urgent messages. These messages don't reach the nurse right away. Anything that is urgent, meaning you need an answer today, needs to be done with a phone call to the nurse. Lastly, MyChart keeps track of your appointments. If you are getting radiation, it's a different story, but for your appointments with your doctor, with the lab, and with the infusion clinic, MyChart is great. If you want help getting set up on MyChart, you can pick up one of these brochures in the Cancer Center Library, and you can also ask Rebecca or a volunteer to help you. I'd like to tell a story about looking at scans and test results in MyChart. A patient reported in our Patient and Family Advisory Council that she got an MRI result for a cracked rib in her MyChart on a holiday weekend. When she opened it, it said, quote, "cannot rule out a tumor break," end quote. She spent 2 days Googling every word of the report, and she still did not understand if it meant that she might have cancer in her bones. When she talked to her oncologist, she learned that it is common for this sort of phrase to be included in these kind of scans, and she did not have cancer in her bones. She had a similar experience trying to figure out a lung scan. Now, She does not open scans or pathology reports in my chart. She says, I used to look at the reports because I thought it would say yes, cancer or no cancer. Now I realize there are a lot of gray areas, so I don't look at the results of the scans in my chart. There's nothing you can do about it before you talk to your provider anyway. The point of this story is that reports on scans in my chart can be hard to understand unless you are a doctor. The terminology can be confusing, and this can cause you unnecessary confusion and stress. Your nurse is not able to discuss the scans. You will need to discuss scans with a provider. You can take control of the situation and decide how much information you do or don't want when it comes to looking at scans and pathology reports in my chart. You can choose. Cancer treatments include surgery, radiation oncology, and medical oncology. Your medical oncologist uses anti-cancer medications to treat your cancer. Due to amazing advances in cancer treatment, there are hundreds of cancer-fighting medications. Not all of them are chemotherapy. Some are immunotherapy or targeted therapy. Often the treatment will combine two or more of these different types of treatments. You'll get specific information about your treatment in your one-on-one education session with your nurse or advanced practice provider. There are videos available for each type of treatment on the Enloe website. You might be wondering, how does the oncologist decide what medications to use for my treatment? Doctors follow certain guidelines when planning treatment doses and combination of treatments. These guidelines are based on research studies that are specific for the type and stage of cancer you have. They look at special tests to determine what treatment is best. For example, not all breast cancers are the same, so treatment plans have become very specialized. Another person you know might have the same cancer diagnosis, but be getting a different treatment plan because the treatment is individualized. Your treatment may include just one type of drug or more than one type of drug. Your oncologist and the rest of your cancer team is also going to monitor how the plan is working for you and may change the plan if there are ways to make it work better for you. Lastly, we want to remind you that you are the ultimate decision maker. The members of your healthcare team are your crew. We provide information and advice, but you are the captain, and ultimately you choose what you want and do not want in terms of treatment. You can even decide to stop taking treatment, and we will still support you. What questions do you have? Some notes you might want to write down for yourself are to sign up for MyChart and watch the new patient videos. Do you have any questions about your team or what they do? If so, write them down. There are different ways that anti-cancer medications are administered to your body. You might even have more than one route in your treatment plan. Your anti-cancer medication may be put into your veins in our infusion clinic. You might be prescribed anti-cancer medications that you take in the form of a pill. Lastly, you might receive your anti-cancer medication in the form of a shot or injection. These injections are administered by our shot clinic here at the Cancer Center. If you are taking oral anti-cancer medication, we never want you to run out. These medications don't come from a regular pharmacy. They come from a specialty pharmacy. At least 2 to 3 business days minimum are needed to process a refill for specialty medications. So put a reminder on your phone or write it on a calendar to order your refills 3 business days in advance. Staying on top of refills is an important part of oral medication treatment. In your patient guide binder, you will find this checklist of what to do to prepare for treatment. A few highlights include make sure that you have a primary care physician to address non-cancer related medical concerns. If you do not have a primary care physician, please get one as soon as possible or get on the waiting list for one. Your oncology doctor does not treat non-cancer related medical needs. You will need a primary care physician to manage your care after treatment, and it's good to have that person on board now. Enloe does offer Find a Physician at www.enloe.org. And if you need help, you can ask for assistance at the Cancer Center Library. Call your dentist and let them know that you are starting treatment. Defer dental work until after treatment, or talk to your oncologist to work out a plan if you need dental work. Fertility will be discussed at your appointment with your oncologist. Bring up any concerns that you have. Have a digital thermometer. Some anti-cancer medications require you to monitor your temperature at home, or the nurse might ask you to take your temperature and report it to her. You get a free thermometer for attending class today, or if you're watching this online, you can ask for a free thermometer at the Cancer Center Library. Arrange for a ride, at least for your first treatment, that someone else is driving you here and back home. After a few treatments, you can see how you do, and you might be able to drive yourself. Get your prescription medications filled and picked up, and then take them. And always make a list of your questions or concerns. There is a possibility that during your treatment, you will experience symptoms that need immediate attention. And we want to tell you now the best way to proceed if this happens, so you won't be trying to figure out what to do when you are not feeling well. If you have any symptoms listed on the important instructions sheet in your patient guide binder, call your doctor's office immediately. The earlier you call, the more likely it is that we can help you without sending you to the emergency department. After office hours, you should go immediately to the emergency department and they will contact you, the doctor. Sometimes people wake up in the morning not feeling well, but they wait all day hoping that they will feel better. And then they call right at the end of the day hoping to talk to their doctor. Unfortunately, this leaves the team very little time to try to get you into the clinic, and you may end up being sent to the emergency department. So don't wait until the end of the day to call. Sometimes people think, I have a treatment scheduled for tomorrow. I'll just talk to someone about my symptoms when I get there. Unfortunately, when you wait until the day of your treatment, it does not give the team time to resolve your issues, and it can delay your treatment to another day. It would be better to call earlier so that we can try to resolve any issues before you come in for your treatment. These important instructions are in the very front of your binder. We encourage you to put them in a place where they will be easy for you to find. If you do have to go to the emergency department for treatment, make sure you tell them that you are receiving treatment at the cancer center. There are masks available at the emergency room. Please wear one while you are waiting to protect yourself from other sick people who are waiting. I know you may not feel this way right now, but you've got the power to do things that will improve your treatment experience. We're going to focus now on some of those practical things that you can do. Knowing how to prevent infection is one of your main jobs during chemotherapy. Remember when I said that treatment affects your white blood cell count? When your white blood cells are too low, that's called neutropenia. When you are neutropenic, you are at higher risk for getting an infection. Getting an infection can be very serious when your white blood count is low because the body is not able to fight off that infection. That's why these infection control tips are so important. Make sure you make a habit of thoroughly washing your hands. Good hand washing takes a minimum of 20 seconds. Teach people that you live with to also thoroughly wash their hands. Preventing infection is so important. Please read through other tips that are in the back of your binder on pages 27 and 28. We are relying on you to stay hydrated. This is also one of your main jobs, and it's an important one, so we have lots of tips for you. The amount of fluid needed each day to stay hydrated depends on your health and your lifestyle. But our general recommendation is 64 fluid ounces of hydrating fluid a day. Ask your doctor what the correct amount is for you. If you dislike plain water, try drinking flavored water or adding a slice of lemon. Other fluids, such as milk, broth, and tea, also count as a hydrating fluid. You can also eat foods with high water content. While drinking water is the best hydration source, many foods contain water and can help replenish lost fluids. Choose foods like lettuce, which is 95% water, watermelon, which is 92% water, and broccoli, which is 91% water. Soups, popsicles, and yogurt also have high water content. Avoid foods and drinks that contribute to dehydration. Beverages with a lot of sugar and or caffeine, such as fruit juice, soda, and coffee, are not effective at hydrating your body. Keep a water bottle with you at all times and sip from it throughout the day. You can even set a reminder to remind you to keep on drinking your fluids. You can also suck on ice chips or popsicles if you have trouble drinking the water. If you are able to drink water easily, take in small amounts of fluid frequently instead of large amount all at one time. One way to get your water intake off to a good start is to drink a glass of water right when you wake up each morning. And a good tip is to try to get all of your water and fluids done before 6 o'clock at night. That way you won't be up as frequently during the night needing to go to the bathroom. If you do experience diarrhea, choose beverages that have sodium and potassium to help replace the lost minerals. If you have fatigue, keep your ice and your drinks within reach so that you do not have to get up more often than necessary to refill your water. And if you are experiencing nausea, vomiting, or diarrhea, or you're moderately dehydrated, your doctor may recommend that you drink an oral rehydration solution. Severe dehydration requires fluids to be given intravenously through a vein. Please keep your doctor informed if you're not able to stay hydrated. Everyone wants to know what to eat. Think of it this way. Your body is working very hard for you right now. It's destroying cancer cells. It's building new cells. You want to give it the best fuel possible right now. The short answer is to eat the best that you can right now. Eat the most nutrient-dense foods that you can. That will look different for each person, and recommendations will be very individual depending upon your treatment. Your nurse can give you guidance based on your specific treatment. We have cookbooks available for checkout here in the library, and you can request the booklet Eating Hints if you would like more nutrition suggestions. We have that booklet Eating Hints in the library or at Infusion Therapy. A dietitian team is available. If your team thinks that you would benefit from a visit, you will be referred. Of course, if you think it would be beneficial to speak to a dietitian, just ask your nurse or your advanced practice provider. If you are receiving radiation treatments, make sure that you follow the radiation guidelines for eating. Certain cancers of the pelvis require very specific diets that improve the precision of the radiation treatments. Please stick to those instructions during the course of your radiation treatment. What is a nutrient-dense food? Nutrient-dense food are foods that have a lot of nutrition in them, like vitamins, minerals, fiber, and healthy fats. For some people, adding nutrient-dense food might just mean adding healthy fruits and vegetables and whole grains to their diet. For people who are doing their own cooking, it might be adding canned or frozen meals or healthy but easy canned soup if they don't have the energy to cook. Some people have other people to help them cook so they can try out new nutrient-dense recipes. You might see or hear old recommendations to avoid raw fruits and vegetables, but this has changed. We want you to be feeding your body healthy fruits and vegetables, but you want to be sure that they have been well washed. Washing your fruits and vegetables removes germs that can cause illness. Since chemotherapy can decrease your white blood cell count, we want you to be particularly careful to avoid foodborne illness. Avoid raw meats, sushis, buffets, deli bars, and the Costco tasting line. And be sure to wash your fruits and vegetables thoroughly and carefully. Your appetite will go up and down with your treatments. Some days you will have a great appetite, load up on those nutrient-dense foods. Some days you will have only a little appetite, and you might just want vegetable soup all day long. And some days nothing tastes good except ice cream. Don't worry about all that too much. You just have to figure out what works with your taste buds and digestive system. Do the best you can, and you will have time to continue to work on your cancer-fighting food diet when you get through the treatment and your system starts to return to normal. Not all cancer medications cause hair loss. It's very drug specific. Talk to your nurse about whether the treatment that you are taking will cause hair loss. At this time, patients can get one free wig and 1 to 2 free hats from our wig boutique in the Comfort Center in the library. If you are choosing to use a cool cap system, make sure that you have someone coming with you to help you change the ice packs. You are allowed to bring someone to manage all of the ice pack changes. They need to stay the whole treatment time with you. Fatigue is the most common side effect, regardless of what cancer treatments you receive. You can choose to do things to manage it, or you can do things that make it worse. Sleeping too much during the day and not getting enough exercise is a sure way to feel tired. Or you can choose to do some of the things on a list in your binder, and it is most likely that you will be less tired. The key is to do moderate exercise and to stop before you get tired. You get to choose what will work for you. Cancer treatment does cause an increased sensitivity to the sun, as well as redness, rashes, itching, peeling, dryness, or acne. Too often, people learn about sensitivity the hard way by getting a bad burn, or sometimes it is more like a rash than a burn. So, to prevent this, avoid direct sunlight as much as possible, and especially stay out of the sun between the peak hours of 10 a.m. and 4 p.m. when the sun's rays are the strongest. Even if you have dark colored skin, protect yourself from the sun. Use a sunscreen lotion with a SPF factor of 15 or higher. Zinc oxide, sold over the counter, can block the sun rays completely. Don't forget your lips. Use a lip balm with a high sun protection factor. Wear long sleeve cotton shirts, pants, and hats with a wide brim, especially if you are experiencing hair loss, to prevent your skin and scalp from sunburn. You might be saying, support groups aren't for me, or I've never needed support through things before. But dealing with cancer is a whole new world, and it can really help to meet with others and learn skills and strategies for managing the added stress that is a natural part of dealing with serious illness. The focus in all of our groups and classes is on encouragement and resilience. There are cancer-specific groups, general groups, groups that focus on creativity as a way to feel better. Remember when I talked about fatigue? We even have a healthy steps gentle exercise class that can help reduce fatigue and offer a chance to socialize. You can talk to Rebecca, the Cancer Support Program Coordinator, or check out the Get Connected newsletter to learn more. How many of you are ready to be proactive about side effects? How will you stay hydrated? Write down any notes or questions. Although nobody wants to have to come to the cancer center, most of the patients tell us that by the time they leave, they feel like they have a new family. We love our patients. Some patients will be in treatment with us for many years. Others will be finished in a few months. No matter the treatment, I think that you will find that this is a place where we celebrate life. The photo on your screen is the celebration bell. It was made by a member of the Chico community and gifted to the Cancer Center. We invite you to ring it to celebrate whatever meaningful milestones you might experience: birthdays, anniversaries, getting good test results, or finishing treatment. It uplifts everyone when we hear the bell ring. I look forward to seeing you at the clinic, and I am confident that you are in good hands with our Enloe Health team. It is our privilege to care for you. Thank you for choosing Enloe Health.